Global Fund has for many years been Uganda's major partner in addressing the country's burden of HIV, malaria and tuberculosis. To this effect, $480 million has been earmarked by Global Fund to support Uganda for the years 2018-2020. The National Facilitator for Global Fund in the Ministry of Health, Henry Katamba, says in the area of HIV, the focus is to reduce new infections and also ensure that the treatment for those infected is sustainable.
In regard to HIV, we have quite a number of interventions that we are doing. We have interventions for preventing new infections. Those interventions, I should not say start with, or they include prevention of mother-to-child transmission of HIV. And there, within the antenatal clinics, we ensure that every mother who is attending the antenatal clinic on their first visit, they actually get counseled, they get tested, and they know their HIV status.
For the case of malaria, $120 million will support the procurement and distribution of 27 million nets in 2020 and to ensure adequate stock of antimalarial drugs.
But for the malaria grant, there are components of training, community support, treatment, medicines for malaria, and also the nets that have been distributed throughout the country. So supposed to support and scale down the process of
But what mechanisms are in place by the Ministry of Health to ensure that the funds are directed to the right use?
Yes, of course, in the past it was very rampant, but now we have minimized. We don't have any outstanding accountabilities. We don't have any funds that are utilized outside the agreed activities. And therefore, we are very grateful that the team implementing the Global Fund activities now is very focused and is going to help us to achieve the results that we want.
The Ministry of Health commended Global Fund for supporting the country's health strategic plans as far as fighting malaria, TB and HIV are concerned. Adiana Kote, UBC.